CVA subluxation is incredibly painful post-CVA subluxation, and Ehlers-Danlos can be extremely painful, and there are some good studies out there. What's your experience with that, Rosa?
Yeah, so starting off, is sound better? I've taken my headphones out, so hopefully you can hear me a little bit better. So the post-stroke shoulder can be highly vulnerable, sort of for a combination of different things. Paralysis, weakness, combined with spasticity. It's asking for basically perfect storm, and over sort of extended periods, this can just lead to sort of really poor postures. Add into the mix complex neuropathy, sort of increased heightened response to pain post-stroke, and you're sort of leading to sort of basically a lovely problem of shoulder pain. There's the main thing I say with shoulder pain, shoulder sort of positioning with post-stroke is to meet patients' expectations. Orthotics-wise, orthoses-wise, they're not a magic cure. And so quite often what will sort of help address pain is not necessarily what will show stability and better positioning if you look at it image-wise, sort of radiographically. And it's really kind of getting to the crux of what is the most important, and can we get a combination of both to an acceptable level? So certain things you can implement, sort of FES can be quite effective from a point of view of positioning and pain. Sort of more complex shoulder braces, sort of better designed shoulder braces is a better way to put it. So ones that are sort of high cuffed up on the shoulder, with or without a forearm shoulder cuff as well, that go across the body under the opposite axilla, sort of really highly padded, so they're not going to cause any problems themselves of sort of nipping nerves, sort of compression. Definitely anything that avoids going over the opposite shoulder. It just sort of, it may sound sense, but the amount of things you'll see people in shoulder slings after a stroke, well, you're just asking for problems because you're pulling on the contralateral shoulder. When it comes to things like Ehlers-Danlos, hypermobility, they are a different kettle of fish and sort of difficult for a number of reasons. Sort of being the altered muscle tone, really impaired proprioception, repeated overstretching, and then if they throw into the mix a previous injury, they're another sort of a perfect customer. And I think physio has got a really important place to play here, sort of getting that balance of resting muscle at that right level, so you don't have any muscles that are overpowering the joint to begin with. Looking at proprioception, and then you can kind of bring in orthoses into the mix, so things like lycra, lycra vests, shoulder shrugs, those sort of more custom-made things really can have a place to play in sort of part of the rehab process. So these braces sort of really help by really good tight fits. If anyone's ever worn compressive garments for running, or sort of sport sort of vests, really tight tops like that, sort of at that at a much higher level, and they really do help with proprioception, sort of compression of the joint, and are sort of taped up and do provide structural support and sort of structural guidance, I suppose is the best way for positioning, but they don't limit movement, so they're not sort of causing weakness, they won't cause atrophy, they won't cause sort of a disuse atrophy as well, or neglect to sort of muscle groups. But they also sort of act as a psychological reminder. I think that's the best thing. So when the person goes into an improper posture or an at-risk posture, there's something there stopping them firmly to say, wait a minute, stop, and back off that, and then that lets them reset themselves before they go and overextend or overinsert and sort of really put themselves at an at-risk position. There's not tons of research behind it, but I have used them myself, say in cases of Ehlers-Danlos. You have to be careful with certain types and the elasticity of skin and the reaction it can have to certain materials. So quite often, before going all the way to a custom-made lycra, which can be costly, try taping, sort of kinesio taping, neoprene shoulder shrugs, try them as a sort of low-cost option, see how they get on with them. And if it works well and they don't have a sort of an overreaction to heat and sort of sweat and sort of get a pain reaction from that, then it really can be worthwhile to go down that route of sort of looking into something more custom made, whether it be one shoulder, two shoulders, stock, made to measure, and sort of really sort of play around with the cheap options first, and if they work, then progress it down that line.
Excellent,
they definitely
thank
have a place to play.
Sorry, done?
Yeah, done.
Excellent, okay, thank you. Actually, going back to a quick point that Rosa made, Ehlers-Danlos loss and stroke. I had some involvement in developing the most technically adept CVA cuff. It's not a cuff, but it holds the whole weight of the arm. They function extremely well, although there's still no evidence on it. And Ehlers-Danlos, the French company with whom I work, did a study in France, because of French, on Ehlers-Danlos and with Cicatrix, which is a compression garment. And they found that by normalizing the motion, which we've talked about, getting people moving more normally, muscle memory, I'm going to use easy words for myself, muscle memory kicked in, the muscle phasing got better, and they had better strength and better range of motion and better control after using Cicatrix for a few weeks. So there are huge proprioceptive benefits to a lot of the things that we try. And to summarise what we've just talked about, patient-centred approach is brilliant. Dogmatic approach, the recipe approach, we know doesn't work, but we do know that still happens around about, so look out for that. And I've worked all around the world, and I can say that there are a good few countries around the world where that dogmatic approach is very prevalent, and you don't see it so much in the UK. You're in a good place here. Our medicine is good.